Sir, may I come in?
Yes, come in.
Sir, there's a patient. He's complaining of headache. He's around 37 years old. Can you please come and see him?
I'll come there.
Okay, sir.
Good morning, everyone.
Good morning, sir.
Yes, I am Dr. Prashant Gunkikar, Associate Professor in the Department of Community Medicine. Today we will learn about how to take the BP, how to measure the blood pressure appropriately with OSCE. OSCE is Objective Structured Clinical Examination. So as per the OSCE, we will measure the blood pressure today, and you will get this is the checklist. So how you supposed to check the blood pressure? Okay.
Okay, sir.
So by step, the first step is I will explain you. First thing is that introduce yourself. Introduce yourself, what you are and what is your role to measure the BP. So काका, मी डॉक्टर प्रशांत गुंडकीकर आणि मला तुमचा बीपी घ्यायचा आहे. तुम्हाला जो त्रास आहे त्या त्रासाच्या हिशोबाने आपल्याला थोडंसं बीपी घ्यायला लागेल. याला काय तुमची हरकत आहे का? ओके. मी बीपी घेऊ शकतो तुमचा? ओके. टेक द कन्सेंट ऑफ द पेशंट and briefly explain what you are going to measure. Okay. Then position the patient. He should be sitting comfortably in the chair. Either you can take in a supine position or in a sitting position. If you are taking in sitting position, properly position the patient, and the arm should be at the level of the heart.
Okay.
So you can keep like this. Okay. Then first thing, before going for any examination or blood pressure measurement, you're supposed to wash your hands. Okay. Then first thing, your apparatus, you ensure that your apparatus is in a proper position. It should be at the level of heart. Check the cuff size. It is ensure that it is completely deflated. It is completely deflated, and we have to confirm. We have to check the. We have to check the cuff size whether it is appropriate or not. Okay, just above the brachial artery, you just supposed to mark the brachial artery. Okay, we can palpate the tendon, brachii tendon, and medial to that brachii tendon, you can palpate the brachial artery. Okay.
Okay, sir.
So first thing, you are supposed to confirm the systolic blood pressure by palpatory method. First thing, you are supposed to close the wall, ensure that the wall is closed, and slowly inflate the cuff.
Sir, I have a question, sir. The cuff that you have put on, how loose it has to be?
It should be two finger. It should not be too tight or too
loose.
Too loose.
Okay, sir.
Okay. Slowly inflate the cuff. Inflate the cuff till you don't palpate the till the pulsation of radial pulse vanish off. Okay. Then slowly deflate the cuff. Okay. And note the blood pressure on sphygmomanometer where you palpate the pulse. Okay. So note that this is your systolic blood pressure, and you have confirmed this by palpatory method. So completely deflate the cuff. Okay. Then once again you are supposed to inflate the cuff just above the level 20 to 30 mm of Hg more than the systolic blood pressure.
Okay, sir.
Confirmed by palpatory method. Okay.
Yes,
then slowly deflate the cuff with the speed of 2 to 3 mm of Hg per second, so that you can properly locate the blood pressure. You're supposed to keep the stethoscope on brachial artery and slowly deflate the curve. Note the first quarter of sound. Go on deflating the curve slowly and note the fifth quarter of sound where the sound disappears. So that will be your diastolic blood pressure. The first quarter of sound will be systolic blood pressure and the fifth quarter of sound will be your diastolic blood pressure. After fifth quarter of sound, the sound will disappear. Okay. So this is the measurement of blood pressure. You have you supposed to note the blood pressure. You can discuss the blood pressure with the patient. Okay. की तुमचा BP आहे आता 130/70 130 आणि 70 आहे आणि हा BP तुमचा नॉर्मल आहे. ठीक आहे. You should document the blood pressure and you can tell the patient that the examination is complete. You supposed to thank the patient. धन्यवाद तुम्ही आम्हाला ब्लड प्रेशर घेण्यासाठी मदत केल्याबद्दल. So you supposed to thank always.
Okay, sir. About the consent for basic procedures like BP and all, we just require verbal consent. We don't need any written consent for that, right?
For basic procedure, clinical procedure, we are doing for the purpose of patient only. So that's why the verbal consent is enough to do the any examination. Okay, that's all for your OSCE examination or blood pressure measurement. Okay, you have understood?
Yes, sir.
Yes, sir.
Thank you so much, sir.
You're most welcome. So today we have measured blood pressure as per the OSCE examination. The blood pressure was 130/70 and it was normal blood pressure. If the blood pressure is abnormal, you are supposed to repeat the reading after 5 minutes and the lowest reading you are supposed to document. So if it is another reading is abnormal, then you are supposed to advise the patient about the treatment, whatever needed, the lifestyle modification if needed, and you are supposed to advise the patient the regular follow. Thank you so much.